how I got invited. I was wondering that. I've been kind of querying that for a couple days. Hi, everybody. Do you love my town? I live here. I live here. And had I known this was the backdrop, I have a really cool thing of me doing Warrior One on top of Devil's Bridge, and I so would have put it in my talk. That would have been really rad, but next time. So I'm going to talk today about complementary, and I literally have to say, we got to get rid of the word alternative. It's kind of a buzzword that creates a lot of havoc in the space of Western medicine. But integrative therapies are here to stay, and for me, it has been a journey of probably the past, since about 2005, 2006, really learning how to walk through a cancer diagnosis with patients. And integrative therapies have become an unbelievably important part of what I do every day. I go back, sorry, those are my disclosures. I do teaching and speaking and have worked on medical technology development over the years. The three bottom ones, Interstill, Caliber, and Gateway Sciences, are the three startups that I'm working with because I was part of your slide with that big burnout thing. I was giving a lecture in 2020, go figure. During COVID, I'm supposed to be giving a lecture in Philadelphia on physician burnout. And as I'm going through my slides, I go, check, check, check. And I call my colleague, Bill Scarlett, who happens to be sitting here. I go, Bill, I have physician burnout. I said, I didn't realize it until I was preparing my lecture on it, but I needed to refuel what I'm passionate and what my purpose is, which is why I'm doing what I'm doing now. So I love this from U of A. I changed it a little bit so it fits for everyone in this room. For those of you who care for women and men with cancer, pause and reflect on the critical work you do. For patients, families, you have guided through this extraordinarily difficult life challenge. Take a moment to acknowledge your contributions and the time you've taken to master this complex field, helping women and men survive with strength or transition to death with grace and dignity, knowing that you were supported at every stage. You are doing important work. You're doing life-changing work. I love this because so rarely do we get recognized for everything extra that we do with our patients in the cancer world beyond the surgery, the chemo, and the radiation. And this is the part, that's the doctor-patient connection, that's the part that heals. So it's funny because I look at the ASCO expert panel from 2017. Who in the world doesn't benefit with quality of life from meditation, yoga, and massage? It's kind of like, okay, so you gave a list of what everybody in the world should probably be doing on a daily basis to take care of themselves, but they just didn't dive in deep enough for me to really be happy with what we're educating clinicians about in cancer care. So we're going to take a deeper dive. This is from Mayo Clinic, 2022 ASCO, looking at supplementation. What our patients are seeking supplements and support outside of the clinic, but if we don't ask them what they're doing, they may be doing things that could be harming them, so we have to ask them. And in 2007, this beautiful woman, Jane Smith, was my patient. 7 years earlier, she had had bilateral stage 3 ER/PR positive invasive lobular carcinoma, underwent neoadjuvant chemo, underwent bilateral radiation. She had neoadjuvant chemo. We all know now she had 2 luminal A tumors because she still had 30 nodes out of 30 nodes on one side positive and 29 out of 29 on the other side positive, but she survived. She was on her aromatase inhibitor. She was in a fashion show in 2007 back at in Philadelphia. She died 8 weeks later at Hahnemann University, having bought St. John's wort off the internet for her varicose veins because she didn't want her varicose veins to be on her legs anymore. But instead of asking and telling us and letting us explore this together, it actually put her into liver failure, and she died not of her cancer. She did not have a cancer cell in her body at autopsy, but she died because of a supplement that she bought off the internet. And so Jane's greatest gift to me has been teaching me to tell other doctors to ask your patients what they're taking. We need to know what they're doing in addition to what we're giving them. So in 2019, I saw this Reuters blurb come across the screen. Patients with breast cancer using supplements during chemo be at increased risk of recurrence and death. And I'm like, oh my God, I got to know what's going on because I have a lot of people taking supplements. But be careful what the press puts out as their headline to try to grab you into, scare tactics. Because what it really did was it looked at vitamins A, E, C, carotenoids, and CoQ10. And what they wrote was it may increase the risk of breast cancer recurrence and mortality. So I took a deep dive because you can't just trust, and they get the headlines like a day before we get to read them in a published form. So I pulled the study and I looked at it closely. And what they looked at was the use of vitamins and supplements before cancer, during chemo. People that had used them before and after, people that didn't use them at either place. And what we found in the study, if you look really closely, patients who had been using supplements prior to their cancer care, but discontinued them during chemotherapy, actually did the best. So are supplements bad? I don't think you can say supplements are bad from that, but what we can say is that we know that certain things, we're trying to form free radicals when we're doing certain chemotherapies and giving radiation therapy. So why would we want to potentially block that with the supplements? So that's really always been kind of the question at hand. But what they didn't look at was BMI. They didn't look at the diets. They didn't look at adherence to antiestrogen therapy. And the patients that actually did best were the ones that took the supplements before, but not during. So what I recommend to my patients is if they're taking supplements before a diagnosis, let's go over everything during your chemotherapy treatment to make sure that you're not doing anything to shoot yourself in the foot. And then when they've gone through chemo, it's okay to go back onto their supplementation, but this is why that open conversation and connection has to happen. We do know that acetyl L-carnitine, which was thought to have cardioprotection, can actually worsen peripheral neuropathy. So we want to make sure that patients are not taking this. And you've got to have that conversation and make sure that they understand that although some studies they'll read can protect their heart, they can also end up with lifelong peripheral neuropathy. Psychosocial issues are always bigger. In young patients, they may be at greater risk. And a lot of times it's because they don't have the same level of psychosocial support, which we know is so important. So over 9,000 patients were looked at in this project, looking at social isolation, elevated cortisol, elevated leptin, elevated increased cell proliferation at the time of diagnosis. And women with small social networks, and we know how well women do in support groups. They do better stage for stage, grade for grade, when they are supported, because social isolation is a poor determinant in all-cause mortality when we look at whatever medical issue it is. But a 69% increase in risk of total mortality, 43% increased risk of breast-specific mortality, those are really important things to understand. We've got to ask our patients, who do you have to support you? Who's coming to your appointments with you? During COVID, I think it's the worst thing we ever did was isolating the patients from their families during their appointments. I was doing cancer consults in my office with someone on a freaking Zoom call with the person beside me, and I went and fought with my hospital and said, I need the support person in there. They're living in that patient's house. How much more of a risk can it be? There's a greater risk to our patients to be isolated than to have me have a risk of getting COVID from someone else. So we've got to ask about connectedness. Peripheral neuropathy, it's the gift that keeps on giving. So why do we not want to prevent it? You can buy these mittens and these little socks on Amazon. They're inexpensive. In a review of peripheral neuropathy, you can apply these during chemotherapy, and the benefit increased with the increased degree of cooling, but they're inexpensive, and you can decrease the risk of long-term peripheral neuropathy. I've actually devised this device in my head. I just don't have enough time to do it, where someone comes in for chemo and they sit down, they put their gloves on, they put their thing, and you have a little cooling thing beside them, kind of like we do in the open heart rooms and stuff. So if you want to take the idea run with it, you can just give me credit a little bit someday. But why aren't we doing that for our patients getting chemotherapy that are at risk for peripheral neuropathy? It's inexpensive. It makes sense. You know, why are we not doing cold caps for patients with chemotherapy? It makes sense. We should have the freezers for them instead of making them bring dry ice. So glutamine, vitamin E, and omega-3 supplementation can also statistically significant decrease in long-term risk of peripheral neuropathy. And my nurse practitioner had triple-negative breast cancer, and it's the one thing that to this day, nobody ever told her about the cooling gloves. They didn't tell her what she could do. And as a nurse practitioner, she's like, why wasn't I smarter to be able to learn this myself? But now she's become the advocate for patients going through chemotherapy to make sure that they can decrease their side effects. 2 studies just presented at ASCO that are beginning from Memorial Sloan Kettering: yoga and peripheral neuropathy, and also acupuncture and peripheral neuropathy. And I love seeing sometimes the largest towers of cancer care really diving deeply into the pool of integrative medicine, because we have to have the scientific research behind this in order to be able to get this to be accepted long term. Acupuncture for hot flashes, I've been using it for years with my patients. This was a pooled analysis that was just presented at ASCO this year. 3 parallel studies in the US, China, and South Korea. Acupuncture 2 times a week for 10 weeks. The usual care was no acupuncture for 10 weeks. And what they found was there were meaningful improvements in hot flashes, endocrine symptoms, and quality of life. It's inexpensive, it's relatively minimally invasive, and it works. And we know that hot flashes and other issues with quality of life are major reasons why people stop taking their aromatase inhibitors and their tamoxifen. They lie to us about it. They come to the office and they tell you what you want to hear, but they lie to us about it. And then when they get a recurrence, it's like, it kills you. I've had numerous patients over my 35-year career lie about it because they wanted to please us in the office, but if I knew they weren't taking it, there are other things we could have potentially done for them. So it works for nausea, vomiting, it works for hot flashes, it works for arthralgias. You know, I've had some patients with post-operative nausea where I would bring my acupuncture into the hospital, acupuncturist in, to be able to provide acupuncture so I could discharge the patient from the hospital because their nausea hangover from anesthesia was so significant. Statistically significant studies prove that it works. Tai Chi, believe it or not, amongst breast cancer survivors, it reduced cellular inflammation. And we know inflammation is a big part of cancer. So becoming anti-inflammatory is tremendously important. Tai Chi is a wonderful spiritual practice. At the Integrative Medicine Conference, we start every morning with Tai Chi on the beach. It's pretty amazing and it's incredibly relaxing. And I wish I was, good enough to be able to do it every morning, but I've gotten my practices down to stuff that I'm willing to be able to do every day. Black cohosh has gotten a bad name, common misconception that it's a phytoestrogen and that it can increase the risk of cancer. Actually, in a study, 2/3 of women that were given this in addition to their tamoxifen for 12 months had a 50% reduction of hot flashes. Hello, how many women discontinue their antiestrogen therapy because of hot flashes? They don't like the side effects of it. They don't like the vaginal dryness. They don't like all the things that go along with it. 74% of women in the control group still had hot flashes. So being able to potentially give black cohosh to help with hot flashes and increase compliance is something we all need to have front of mind when we talk to our patients. I love certain homeopathics. Ristoxodendron and rutagraviolins were shown in a study to help with the arthralgias that come with the aromatase inhibitors. So when I start someone on Arimidex, I also have them start taking the homeopathics because if we can stop the arthralgias before they hit, the patients have a much higher chance of staying on them and being compliant. A little known pearl is fasting for 14 hours a day decreases the risk of recurrence of estrogen receptor positive breast cancers. And we think it's probably due to changes in glucose regulation, improvement in sleep, decrease in obesity, decrease in fat. I do it every day. I actually tried it before I told my patients to do it when the trial first came out in 2016. I tried the intermittent fasting, and once I was able to see a decrease, and it's actually the belly fat, which is amazing. Your jeans fit better when you do intermittent fasting. It's a wonderful little gift, and for women, we all know that menopause is like the worst kept disaster that no one told us about, our metabolism decreasing 10% every decade. But with the intermittent fasting, we have a chance of potentially fitting back in our jeans from college. I'm not trying the high school ones on ever again. Radiation therapy fatigue. Definitely, we have so many things we can do. And the fatigue hits at week 3 and 4. These patients are they've got to, get up and go and keep going to radiation. American ginseng, this is funny. When this study came out in the Radiation Oncology Journal, one of my not so integrative radiation oncologists on the East Coast, Bob Cardinale, came up. He's like, Beth, there's a clinical study that shows that ginseng decreases radiation fatigue. And I'm like, I know about it. I said, I can't believe that you're coming to me telling about it. But to have a clinical trial show improvement, and it's got to be American ginseng because it's the way that it's developed, but also exercise works, aerobic exercise and yoga. These are things that we can get our patients to participate in during their radiation therapy to help them make it through the entire course of treatment without issues. So these next two, green tea, 25% reduction in breast cancer recurrence, 5 cups a day. I tried drinking 5 cups of green tea a day. I can't do it as a surgeon because I got to pee too much. So you can actually take green tea capsules, which do the exact same thing, but it works. Combine that with reishi mushrooms. Reishi selectively inhibits cell viability for the breast cancer cells, but not normal breast cells. And there is some ongoing research in reishi with inflammatory breast cancer, which I'm really excited about because because of its anti-inflammatory properties. So reishi mushrooms, a gram 3 times a day, it improved anxiety, depression, fatigue, and decreased inflammatory markers. So it has some real promise. But when you combine the two together, there have been suppression and growth of invasive and metastatic breast cancers, which is a very big thing because these are naturally occurring substances. Think about it. One of our biggest chemotherapies we use in breast cancer care is Taxol from the Pacific yew tree, all right? So if we think about what can we get the most bang for the buck out of nature from, green tea and reishi mushrooms, I'm all in. Turkey tail mushrooms still have a lot to be discovered with turkey tail, but we know that we can increase lymphocyte counts, increase natural killer cells, and it's in a dose-related response. So further research is needed. Mushroomconferences.com is a great website. If you want to learn anything about medicinal mushrooms, it is an amazing compendium of all of the latest research because there are many natural plant medicines that I think we have a lot to learn from. Melatonin can inhibit breast cancer cells in animal models. We know that with poor sleep, we do poorly with poor sleep. We get more anxious, we get more depressed. So melatonin in and of itself as an excellent sleep aid is wonderful, but I think clinical trials over the next couple years may be able to show even greater benefit from melatonin in breast cancer patients. So 2 things that really should be avoided, red clover and Don Quai. There are a lot of patients, just like my patient Jane, who thought that anybody that says anything on the internet, that if it's a supplement and they got it from the internet, somehow it's going to be beneficial, it's going to help them. They really need to be avoiding these 2 herbs because of their estrogenic properties. So this is why we have to ask patients what they're taking. And I think it's important to avoid anything that has potential harm, even if we can't prove absolute harm. I don't want to be stimulating estrogen receptors in my ER-positive patients. It's not something that gives me a lot of comfort to sleep at night. We all know that aspirin comes from the bark of a willow tree, yet another plant medicine. 13% reduction in triple-negative breast cancer in stage 2 and 3 patients. To take an aspirin a day, I do take my aspirin when I travel on airplanes. I still believe that there is some benefit. But this was a study that looked at distant mets in triple-negative breast cancer patients. So an aspirin a day to help potentially decrease. And the thought is that as aspirin works as a platelet inhibitor, you're keeping things from sticking together. So it's another anti-inflammatory type process. This was really interesting. This was from ASCO this year as well. Most minority women are found to have less compliance to their anti-estrogen medicines, but they're not given the opportunity to understand or be educated about the integrative therapies that we have, like the acupuncture and the ristoxadrendron, the rutograviolin's, the other things we can do to mitigate those side effects. Because if it's a side effect of an anti-estrogen that's causing someone to stop, we need to go back and help fix the side effect, not get rid of the medication. So this University of Chicago study really showed that there are racial disparities in integrative care. So these are the supplements your patients should absolutely discontinue prior to surgery. Platelet inhibition, risk of bleeding, obviously MAO inhibitors, kava, ginseng. These are all, these are the basics that, in my office I would have, even though I asked the patient, I'd have my surgical scheduler ask the patient as well, educated my anesthesiologist about it. But it's just smart to just not get into trouble by having someone take a supplement they think is no harm, but could potentially be harmful. So here's my new world. This year I got certified in psychedelic therapy, and you might say, okay, you're a breast cancer surgeon, 35 years experience, prior academic appointment to Penn, yeah, and I don't know that they know about this, but believe me, my East Coast hospital where I'm chair of quality and reliability on the board, I've just gotten invited to give a keynote address on psychedelic therapy and cancer care because every week another article, it was in the Rob Report this week, every day, Netflix, How to Change Your Mind is on there. I got to a place in my career in the end of 2019 where I was personally stressed out to the max because of a lot of stuff happening in my health system out here. And I was doing a lecture on health and nutrition for Healthy World Sedona. And when I was pulling slides off the internet, I found Michael Pollan's book, How to Change Your Mind. And I thought it was How to Change Your Mind about food because his book, Food Rules, was amazing. And I use it all the time. So I started listening to this book driving to the OR, and I'm born in 1961. I was like, LSD, it's evil. People jump off of, they jump out of windows. And I listened to this book on Audible, and boy, was I a convert, because I recognized that, we believe what we're told over and over again, and I needed to take a deep dive. So I dove into that psychedelic pool, because the science behind what I found is undeniable. So Bill Richards and Roland Griffiths did a study out of Johns Hopkins where they took patients with end-stage cancer and they provided them with a single dose of psilocybin with an appropriate set and setting in a guided process where they were safe, they were monitored. And psilocybin is a magic mushroom. In 2019, I didn't know that magic mushrooms were psilocybin. I didn't know that MDMA was Molly or ecstasy. Like, I literally was that doctor who was totally not there. So now I do know how to spell psilocybin and ayahuasca. I'm very proud of that. But this clinical trial showed that they were able to decrease depression and anxiety by 78%, 83% respectively in these patients, enduring effects beyond 6 months to 12 months, now to 18 months, increasing quality of life and decreasing death anxiety. And when you think about what we do in hospice and palliative care, can you imagine us being able to give that experience to someone who is, they're getting ready to leave their family? What kind of a gift is that to the family and the person to be able to alleviate that existential crisis? So I took it one step further, because I started to become a fan of Bill Richards, who actually was one of my professors through CIIS. His wife died of breast cancer at the age of 50. He knows what a difference it made in her life. And what he wants to see done before he dies is a prospective randomized trial in 200 early-stage breast cancer patients using a single-dose psilocybin to follow them for cortisol, for stress, looking at all-cause mortality, looking at stage, grade, everything. And that is the work that I'm choosing to do over the next few years of my life. Is I'm going to do that clinical trial. So what better place to do it than Sedona? Because this is like the healing Zen place of the world. So I've just put it out there in public so you guys all know about this. But I believe this is incredibly, incredibly important work, because I can cut out the cancer, but I can't cut out the fear. So right now, ketamine is our only legal entheogen in this country. I've done a deep dive into this for palliative care, for pain management. It is an amazing, drug that we can potentially harness right now for our cancer patients, particularly that have chronic pain, that are in hospice and are transitioning. So it's something that we're going to be opening a ketamine clinic here in Sedona in January, and that's where we're going to actually be doing our research as well, because I can keep cutting cancers out, but I think that my greater gift to healthcare has to do with everything that I'm about to do in this next phase of my life, which is why I'm glad I walked in during the first lecture today, because, well, the lecture about physician burnout and really finding your passion, because I found mine. And meta-analysis, IV ketamine is way better than any of the other things, but it's got to be done in the appropriate set and setting. It's got to be done in a clinical assessment. Patients have to be really vetted very, very well. This is not about someone going on a Zoom call and getting S-ketamine in the mail. It's making me crazy that this is happening, because I believe that it's potentially going to undermine the work that we're going to do in this space, which we really, really need to do. So this is how you can find me. I love being here. I love that I got to hike all morning, hop in the shower, and drive down the street to give you guys this lecture. This is the view from my porch, so if you want a glass of wine later tonight, you can come. We have to get a really good sunset. We need lots and lots of clouds. And sometimes you need to follow the subtle signs in your life, like this one that was above my porch one morning. We call it Boob Mountain, kind of interesting for a breast cancer surgeon, but it's right outside my door. And that arrow was pointing me in the direction away from staying in a health system that was being very toxic for me and was not honoring my patients, wasn't honoring me. And thank you, guys. Any questions? Did I scare you? Yes. Oh, I can do that. Okay, I'm super quick. There you go. Yes. Out here? For the psychedelic clinic, or for the hospital? Well, there's a shift happening here in healthcare. We need amazing physicians. When I left the health system here, I didn't leave this area because my goal is to attract other physicians who are like-minded, that are equally as interested in healing as they are in treating with traditional Western medicine, because the two together are so powerful. I give my patients surgery, chemo, and radiation based on NCCN guidelines, but I make sure we bring all those other pieces in because I think it does better for us as physicians. I think we end up liking ourselves better because we have our quality of life. And what happened over the course of like the COVID time, I became a surgical technician. I was doing over 250 primary breast surgeries a year, and I wasn't giving the attention to my patients, and I certainly wasn't giving it to me. So the answer is yes. The goal is to attract like-minded physicians that want to live in a place and work in a place where we can make a difference in our community. So yes. Anybody else? I'm sorry I went 2 minutes over. I'm a bad girl. Thank you, everybody.